இன்றைக்கி மறுபடியும் சினி 39 எபிசோடில் சந்திக்கிறோம். நான் சிவராஜ் சந்திரன், என்னோட எப்போதும் போல்
நான் சிவமுருகன் பாண்டியன்.
இன்றைக்கி ஒரு முக்கியமான பிரமுகர் இருக்கார், நம்மளோட ரொம்ப ஃபேமஸான ஆள் சோஷியல் மீடியாவில் பார்த்திங்கன்னா டாக்டர் மணின்னு. அவர் ஹெல்த்தை பற்றி பேசுகிற ஒரு நிபுணர், ஒரு ஸ்பெஷலிஸ்ட். பட் இன்றைக்கி நம்ம இப்போ ஜெனரலாக இந்த எபிசோடில் நம்ம ஹெல்த்தை பற்றி பேச போகிறோம். எப்படி நம்ம இந்தியன் மக்கள் மட்டும் இல்லாமல் இது என்டையர் மலேசியன் வி ஹேவிங் திஸ் ஹெல்த் இஷ்யூ, ஒரு சீரியஸான இஷ்யூ ஓடி இருக்குது ப்ராஃப். ஸோ எஸ்பெஷலி அந்த க்ரானிக் சிக்னஸ் லைக் டயபெட்டிக், blood pressure and cancer and things like that. So we're going to discuss specifically on that. Before that, please like, share and subscribe our page. அதை செய்யுங்க. சனி பாட்காஸ்ட்டை தொடர்ந்து நீங்கள் ஆதரவு கொடுக்க தான் மீண்டும் நாங்கள் இந்த மாதிரி நல்ல விஷயத்தை உங்கள்கிட்ட பகிர்ந்துக்கிறதுக்கு எங்களால் ஒரு ஊக்கமாக இருக்கும் எங்களுக்கு. டாக்டர், how are you, doctor?
I'm very good.
Thanks for accepting our request and thanks for you are going to share நிறையா விஷயத்தை ஷேர் பண்ண போகிறீங்க. You going to share about health and things like that. I've seen your videos. It's quite aggressive but I a certain point நான் உங்களை I agree with you because சில விஷயங்களை நீங்கள் அப்படி சொல்ல போனால் தான் கேட்பாங்க அந்த இதுன்னு. பட் ஓகே, ரொம்ப டீட்டெயிலாக சிலது கொஞ்சம் நார்மாக இருக்கிற அட்வைஸோட கொஞ்சம் அக்ரெசிவாக இருந்தாலும் உங்களோட கொஞ்சம் வித்தியாசமாக இருக்கும். பட் what do you think இந்த chronic disease பற்றி what do you think? I mean இந்த லெவலில் இருக்கும் இப்போ நம்ம நாட்டில்.
No, chronic disease is biggest disaster in Malaysia. It's not on Malaysia, around the world. There are a lot of myths, misinformation about chronic disease. Like very general diabetes, hypertension, rheumatoid arthritis, all the heart issue. Where until now the doctor said can I reverse. It's a lifelong. Penyakit semua hidup. It's a big liar. They're a big lie to us. It's a big liar. It's the biggest myth. Even until now, all the specialists, even GP, any doctors, until now they're saying that diabetes cannot reverse. It's a big lie.
Oh.
It's a big lie. This is very important now. Because their diabetes, I just taking diabetes first. Because of diabetes, they're managing only symptom and sign with medications. Every year, the big pharma will come out new medication. Until now, even they're prescribing medication. You can ask any specialist or any doctor, whatever the medication giving, doesn't matter it's medical center or government hospital, are they reverse? No. They say life, kena makan semua hidup. Yeah. It's big lies they did. This is a mythos we are breaking now. It's a code breaker. It's for me, it's a very important. I'm angry because they are lying to us, lying to the patient, because they cannot reverse the diabetes, all the complications, A to toe, from high cardiac issue, from kidney issue, kidney failure. Because of them, they are giving only medication. And heart issue, everything connect each other. Chronic disease, it's all connect. They never reverse. Where my patients until now, their success. Short period. They say for life, I did 3 months, 6 months, the reverse become a normal.
You mean from diabetic patient?
Become a normal.
Become a normal without diabetic.
Where I did my own formula, I call a formula Dr. Mani. Soon I'm going to launch my own book. It's very important for mankind actually, especially Malaysia. You know how many billions, KKM throwing money for chronic disease, diabetes. Every day patient waiting from the morning until 11, so many hours. Right. For chronic disease, every 3 months I had to go top up. They never reverse and become a heart attack or kidney failure. So many problems. So main issue, the chronic disease, where I'm in my book, Formula Dr. Mani, I teaching them how we can reverse all the chronic disease easy way by Alami, naturally, without medication. Because God created our body such a way that our cell, our body can reverse back whatever the disease. It's not a miracle. It's already God created like that. Our body, we can reverse back that. I can bring me one patient, diabetes, or any specialist, or where they're giving now medication until now. Doesn't matter how expensive now. Bring one patient, I can reverse the patient 3 months. I challenge, take I take a challenge.
But how do you describe that is chronic? Bagaimana kita definasikan takrifan?
Chronic disease, they saying that disease cannot cure. Kena makan ubat semua hidup, cannot cure.
Jadi
So you have to take a lifelong medication. That is we call chronic disease. There's two, acute and chronic. Acute means that is where the medical field doing fantastic job. Accident, operation, emergency, everything, they're doing fantastic. But come to chronic, that means for lifelong medicine, they are failed. It's where it's a big pharma playing a biggest game. They make us dumb. And all the doctors and specialists, they are just follow their big pharma control. That's it.
So you're using natural ways, or you're not? You don't believe in the modern science?
Don't believe that. That is the truth. Actually, that is true. That's why I challenge any doctor, bring your patient diabetes medication. I can teach the patient how to reverse back by natural without medication.
Without medication?
Without medication. I'm not giving any medication. I'm not giving any some magic, some scam or some MLM product. No. I teach them how to do. I success actually. I'm proudly to say I'm success because you look at my TikTok, how many followers, how many patients that follow me. Even I got patients from Dubai, from Indonesia, a lot, Jakarta, from Brunei. They're coming to see me by appointment because can see the result.
Right.
Even though it is a very severe cases.
What kind of severe case? Because they make it severe. They make it severe. Why patient dialysis? Why kidney problem? Because they never reverse.
And so it has to be before that stage. And the dialysis problem there, they have
from
to...
the beginning, they catch
pre-diabetic lende நம்ம செஞ்சிரணும் அது.
There's actually no pre-diabetic actually. There's either you're diabetic, chronic disease or no diabetics.
Right.
They're all putting, the medical field and big pharma putting a lot of terms, make it confuse us. Confuse us. That is a very simple way. You have to go back to how ancestors they live. This chronic disease is not a genetic. It's not, they call it genetic. This is all modern.
Some say diabetic is also inherited.
No, they're liars. Genetic means it need at least 200,000 years to get on gene is a mutation. I mean difference. Like our skin color to go back to the white need 200,000 or 100,000 years. Genetic is a modern disease. Under 200 years just came in. How come become a genetic? When the doctor said if they cannot answer, this genetic. Ma ada, you ada. Apakah இருக்கு உங்களுக்கு இருக்கு அந்த மாதிரி. So it's a big lie they did. Actually, a lot of scandal. KKM had to look at this issue. Hopefully I will launch it by October my book, and hopefully Rakyat Malaysia get benefit from that. A lot of patients.
Yeah.
I can probably say 100% my patients who follow me success.
Because doctor,
they all connect each other actually.
ஆனா பாத்தீங்கன்னா cancer for எடுத்துக்கோமே cancer final stage சொல்றாங்கல.
Okay.
Can you cure on the final stage?
Okay, what is cancer? There another biggest scammer, chemo or this thing. Cancer is a metabolic disease. Yes, that is a genetic small. If you ask me, everybody have a cancer genetics there. Who trigger factor? Yaar and another stimulate back the cancer gene because of food.
Food, right.
The food is the biggest issue. The food industry. In this world, there's a two field biggest in the food industry. Western country, the control. They're giving disease for us, and big pharma giving medication for us cannot cure.
Yeah.
There's two industry. The biggest nuts.
So you have to subscribe to the medicine every month.
Every month. Until now, in KKM, how many billions?
I heard, doctor. I don't know how far it's true. It seems that if let's say you are having your diabetic is starting now, but when you started to take the diabetic pills, it's actually not improving. It makes you worse.
Exactly. Even insulin make you more worse. But no, if any specialists agree, no, they don't agree because they all under control big pharma. They are very ego. The problem with the doctors.
So are you saying this is a scam by big pharma?
For me, yes. The problem is that the specialists, you want evidence-based medicine. Evidence-based medicine sponsored by whom? By big pharma. Insulin will make more worse. My patient is off the insulin. I will put him in first I put fasting, puasa. Either intermittent fasting or the puasa Muslim, puasa Ramadan, something, puasa Sunnah, something like that. And after that, real food. There's a few formula I write it where I'm success. The patients wonderful.
So, but at the same time, co-currently, do they still takes? I mean, like the medication, or they stop?
Depend on case by case. Diabetic patient I stop immediately. I put them my way how to do. They can reverse immediately or stop. Immediately. It's the medicine. Diabetic medication is a toxic for our body. Because we don't believe our body, our cell.
I was told by some doctors, I mean senior doctors from government doctors, they said இது எடுக்காதீங்கப்பா, இது வந்து இது இன்னும் மோசம், இதுதான்ப்பா கிட்னிக்கு ஃபெயிலியர் ஆகிற காரணம் இந்த மருந்து தான் அப்படின்றாங்க. ஸோ எங்கள் அம்மா அங்கே போயிட்டு இருக்கும்போது மது அங்கே போகும்போது அந்த டாக்டர் என்கிட்ட சொல்லும் போது நம்மளுக்கு பயம் வந்துடுது.
But they didn't give an idea why she get the diabetes. They didn't give an idea. The solution didn't give.
No, we all thought, I mean, like, see, if, let's say my family, they have diabetic, so we thought it's genetic.
No, it's not genetic.
So, I mean, other factors, of course, maybe during the younger time, my mother would have consumed more sugar and so on. She likes to eat Milo. With
that is processed food. Another food industry.
So
food.
The multiple factors maybe.
So many in Malaysia actually the scammers. Okay, I talk another very simple. Milk. Kena minum susu untuk kuatkan tulang. It's the biggest scam. We no need to milk. It look at the natural. Mother breastfeeding until 2-3 years only. There's a reason after 3 years she not giving any feeding. So we no need to milk actually. But this food industry giving milk. Kuatkan tulang is a big liar. It's another increase inflammation of body. Can get diabetes. Milk is not necessary.
No, I saw your TikTok. You explained
so many simple things. It look like a very funny, but it's a lot of scam because we're stuck in the food industry actually.
So that's diabetic. About Malaysia, doctor, I read in the news statistics about 20% Malaysians are diabetic.
No, more than that. More that they didn't do proper. If you ask me, Stan, I can tell you who are they diabetes going to get diabetes. They say diabetes adaka tada is a wrong way. You have to do when going to get diabetes. You check the serum insulin. From the serum insulin, we now when you going to diabetes. Nobody, even as cardio, I mean, any specialist never check. They only check HbA1c. HbA1c is too late. If when HbA1c go already 80% already.
Can you repeat what is that?
HbA1c is it? No, serum insulin. That is serum insulin must be below 10. That must make.
That is an indication that.
That's indication. If that is going up, you're on the way to get everything.
You're sure you'll get.
Yes, that is processed. You know how long to get diabetes? 20-25 years, 15 years, something like that. You know how long to get a plaque in the heart? 15-20 years. It's not like just a few months or 6 months. No. It's a longer period. So you have to catch early. Even
so, நீங்க என்ன சொல்றீங்க டாக்டர்? All these diseases is connected with food. What we consume is what we get.
Our lifestyle and food.
Lifestyle.
Currently in Malaysia, the worst.
But not only, I think, not only Malaysia, worldwide, globally, we are having this.
We don't care about others. We've got Malaysia.
But you see, doctor, but how to escape from this lifestyle, the current lifestyle?
That is what they have to read my book. How fasting, all the religion teaching, the fasting, puasa, you have to do.
So,
you have to
cut. Puasa lah.
Puasa and reduce. Don't eat so many 4-5 times. No snaking all. Just take morning, no breakfast. Another scam. Breakfast is compulsory. It's a Kellogg's company from food in the Western country. They scam us. Oh, breakfast is very important.
So they promote
the Kellogg's, the cereal.
Kellogg's cereal.
Breakfast is not important. Shouldn't be important. Take no breakfast. Take one day or two times lunch and dinner. Done. You are halfway.
How to live without roti canai and nasi lemak?
That's the problem. That's the problem.
that is the main cause of everything.
Then they go back and see the doctor specialist, hoping they give a magic medication. It'll be okay. That's the issue. And the kidneys problem, heart problem.
Unfortunately, Malaysia is
getting worse.
And also without teh tarik, you cannot live.
Yeah, so unfortunately, I would like to use the word unfortunately, Malaysia is rich with good food.
Yeah.
Good food, and
especially
cheap.
roti canai, nasi lemak, all this.
Everything, cheap some more. And
but as you said, I agree with you because we have to control.
Kedai 24 jam, everywhere they open. It's it's never ending story. But
back to basic, it depends on the individual whether we want to control or we want to go and eat and things like that. Okay, I mean that's diabetic, doctor. So, but what do you think about exercise? Do exercise help to
Okay.
reduce the number of diabetic patient or chronic diseases?
It's
The
only-
reason he's asking because he's going to gym every day.
No, exercise is a top up only 10-15% only. If even how diabetes, you do everyday exercise, not going to reduce the diabetes.
Right.
90% follow the fasting, real food, no processed food, no sugar. My formula is starting with the zero sugar, no sugar.
Oh, you
Sugar-
promote zero sugar.
Zero sugar is a processed food. That's the one killing us. You know, the sugar starting from where? Formula milk. All the formula milk, all the tons of sugar. You know how the food industry controlling us? From baby, they controlling us. So a lot of scam in Malaysia going on. Even on doctors saying that pisang goreng boleh makan. How come in Malaysia pisang goreng boleh makan? Oh my God, it's a very common sense. Pisang makan pisang lah. You don't need to goreng also lah. So oil, so many issue. So for me, it's like desire because I confident I can see my patients get the result.
How many patients you see a day, doctor?
I just limit. I have other doctor group. Of
Do you have a
doctors.
clinic or anything?
We have group of doctors. I mean
group of
clinics.
Medical doctors are the
Yeah,
doctors.
doctor. Damai group.
Damai group.
So now I take him by appointment only.
Oh.
So patients coming from very far, from sometimes from Jakarta, from
Right,
Medan,
right.
and from Brunei. So they're coming. Sabah Sarawak. So I just take appointment. One day I'll take only 5 patients because I need to explain to them.
Exactly.
And I can see the result. They're happy with that.
So you have results. this
Thyroid
is important.
problem, obesity very easily. I can reduce the body weight without medications.
Yeah.
That's why I can challenge any even specialists. Also I can challenge with them.
So
Because I
yours
confident-
is like back to basic about food. It's about your diet.
how
fasting.
our
and
ancestor.
what is the content of the food? These two things. Like
Yeah,
maybe.
exactly.
Fasting as well. lah.
The real food we call real food.
fasting and the content
The
of the food.
Real food and how many times?
Yes.
Yes.
How we do. Very good. Very good.
Have,
So
KKM consulted you
No.
on your
they,
method?
They are just angry with me.
I want to ask you from your TikTok. Did someone suit you for? I don't know. No, so far no. Right.
Nobody sued me. Are they brani? Why they want to suit me? I curing patient.
Yeah, you have
become
evidence.
healthy. I'm waiting for the sue. What in based on what?
Doctor, what's your advice? Like, see, let's look into this perspective. Indians, obesity, diabetic, blood pressure is very
Wow.
synonym to our community, right?
We are
doctor?
very less than 10% Indians. But we are Indians, the sickness almost same like Malays. We are like brothers, Malays and Indians are same.
Because
Whatever
we love
have-
food.
Yeah, they love we eat. Banana leaf, the poor problem is carbohydrate.
Right.
Carbohydrate, oil, overcooked and not healthy and eating late night. And that's why I look at the Indians mostly of our tummy. If I can see tummy, there's the starting problem start, insulin resistance start.
Because, how, Prof, you controlling your food? You're from Penang, nasi kandar bukan selalu
No, I don't. I
Prof from
control
Penang.
food. I exercise well.
But you look okay.
Yeah.
I have to do blood test whether it's.
So basically, that's why I'm asking India, because you see a lot of cases among Indians.
a lot of-
and they,
even I have
and
a
they
lot
don't
of
know.
Indian
They don't know what to do. That's
Yes.
the worst thing that can happen to them, because they don't know what to do.
Ah.
They will just walk into the hospital. They will get daily monthly treatment. Now there's no monthly treatment. It's 3 months once. So in between, if they have any wound or anything, they'll suffer amputation, and இந்த மாதிரி நிறைய நடந்துகிட்டு இருக்கு.
Yeah, we can stop all this amputation, kidney disease early. Just reverse in 3 months can reverse, 6 months can reverse. Why want to
But doctor, to be very frank, this is new terminology lah. I mean, even for us,
Yeah.
you say it's reversible. Diabetic is reversible.
Definitely.
So I think this is what we have to be loud here.
Exactly.
You have to tell them. You have to tell them it's irreversible, and of course, most of them they are not they cannot afford to pay much for the medication. So maybe advice they can
No.
give them a good advice.
This is what I'm teaching the former Dr. Mani. It's a free. I mean, free means it's no need to buy any medication.
Right.
Just control your mouth. And fasting. Fasting is free.
Right.
And eat just cook at home. Buy healthy food, cook at home. No sugar. You go any mama restaurant, no order. Don't just order ai kosong.
Nah.
Don't order teh tarik all. Why?
Right.
And the last, very important, love themselves. They must love ourselves.
Yeah.
If no love, cannot. Must love.
I think discipline and consistency also. is
Exactly.
important. If you're not consistent
Yeah, consistent.
with what you're
No,
doing,
even for the matter, we control food, we work out and so on, but we still find it difficult, to attain whatever we desire in that short period. So most of people, maybe because we know it's not like 1 day, 2 day, a month or a year. It's a long-term process, and you have to be consistent. But for people outside there, they think like, can I see the immediate cure 1 week? கடத்தி நின்றுமா எனக்கு இது பண்ணிடு.
That's the problem, Malaysia. இதனால தான் எல்லாமே
அப்புறம் ஒரு கட்டம் வந்து விட்டு கிவ் அப் பண்ணிட்டு திருப்பி சாப்பிட போயிடுவாங்க.
எல்லாமே இன்ஸ்டன்ட் ரிசல்ட் வேணும்னு சொல்றாங்க.
That's why all the MLMs came in, they came in.
ஆமா.
All the MLMs came in, whatever product, okay, they don't care about what I see. Okay, makan ini boleh okay.
ஆமா.
Lot scam in Malaysia. I just wondering why there's how a lot of ministers not taking any action. Especially KKM. So many drugs, so many products. They claiming say this talking, that talking, all can cure. Astan can cure. So many liars,
Scams, yeah, scam.
Lot of scam. Why no any action from a government Malaysia? Kerajaan Malaysia why not?
Mungkin some maybe tak ada laporan.
That's
But
why they have to seriously. Have to
see,
look at
only
it.
somebody if somebody want to report, he must know that is scam. So maybe no people not bothered. Some they trust.
Yeah.
You see, I saw one recently one advert. I've been seeing that my algorithm, health and things like that, pills. The fellow said he was fat. Suddenly he started to take one pill. Then that pill makes him lose 15 kilo. I was thinking, hell, we were like spending an hour plus in gym every day, control food. We can't eat that, no sugar, no carbs. But this fellow said just eat pills too, you boleh kurus. So people yang tak ada masa, yang sibuk, office.
Nah, people Malaysia want the easy way.
Easy way. They say, better ambil bubat tu lah. So 1 million people kata nak kudang barang dia beli, their fellow already made his money already.
Until the kidney gone, then will come.
Right, like I said. See, that's why we di sana sini ni kita memang tak galakkan, and we oppose all this beli ubat-ubat yang scam. Dia kata ada shortcut. Dia kata kalau memang hari ni makan besok boleh apa. Itu jangan sensitif tu. Dari sana sini isu. Hari ni makan besok boleh jadi apa, sehat, boleh kurus. That's all scam. Please தயவு செய்து அதை நம்பாதீங்க. ஏன்னா அது வந்து முழுக்க போய். ஏன்னா எந்த சீக்கம் எந்த பிரச்சனைக்கும் உடனே இன்னைக்கு சாப்பிட்டு நாளைக்கு நல்லா போயிடாது உங்களுக்கு. ஸோ அதனால் வந்து இந்த platform வந்து நம்ம பயன்படுத்தி அதை வந்து just to create awareness kepada semua rakyat Malaysia, jangan terpedaya dengan scams begini. Hari ni kalau makan ubat ni besok boleh jadi kurus, satu otot naik. I think that is scam. Kita pun tahu tapi sengaja kita nak cuba, and as what doctor said, end of the day kidney masalah kidney, jantung and so on. Yeah,
I think
Nowadays,
one point we have to love ourselves. That's
exactly.
what you said.
But I wondering now, I get patient all 30 years, 31 all stand.
young people.
Young people getting. I'm not surprised actually, because they getting from the born, they getting to eat all the food, all the processed food, ultra processed food.
I got shocked when my friends 30 plus 2 blocks, 3 blocks.
3 blocks. It's good for doctors, cardiologists.
But that one is curable, reversible.
They have to stop. If they say 2 blocks, it's not only for the movement. There are actually so many blocks on the way. There are so many blocks on the way because they never reverse the insulin resistance in the body. I got a patient recently on patient IJN follow-up. Their heart function reduced to 27%. 6 months follow-up means 68%. I saw last week the patient from Bahang. It's a success story. Just fasting, real food, and supplements we need. That's it. We can see the miracles in our body. The one going to cure our body is our cells in the body. Our cell can cure. It's everything. All the specialists in our body.
Yeah.
No need to go search other side. It's no any drug. The drugs is only acute management. For chronic management, our cell can cure. The liver, pancreas, heart, everything can cure. Enough sleeps, exercise, healthy food, fasting, done.
So you're going to publish your book?
Yeah, soon I
focus
going
on
to publish.
that
Yes.
by October.
Yeah, so
You're going to sell, or they have to download, or is it
I
only
think
online?
hard copy.
Hard copies, is it?
Yes, hard copy.
So they will be able
It must
to...
the request from us, so make it accessible to all, so that
Yes.
the benefit of whatever research
in all
you've done.
languages, or
First Malay and English. We are planning to Chinese and Indian also.
Tamil, right? Say no. Yeah, I think we should share lah.
Sure, we can share. Under formula Dr. Mani. Because I really proud because I can see my patients, even your parents, any with diabetes, bring to me. I can reverse to them.
Oh,
The only thing they have to love and follow me.
right.
Yes. Medication not going to cure. They say maka semua hidup is a big liars. Even the doctors don't know.
Betul. I think after this episode, many people are going to call us and going to ask, where's your clinic, where's your place, and so on.
I wanna see
Because this is a common sick.
Yes, sir, yes,
சாமியில் சொல்லுவார் ஒரு வீட்டுக்கு ஒரு பட்டதாரின்னு. இப்போ ஒரு வீட்டுக்கு ஒரு ஒரு டயபெட்டிக் பேஷண்டாச்சும் இருக்காங்க.
கண்டிப்பா இன்னும் 2 ஆயிடுச்சு.
2 போயிட்டு இருக்கு. அப்பா தாத்தா போய் அப்பாவுக்கு வந்து இப்போ பையனுக்கு வந்துருச்சு. நீங்க சொன்ன மாதிரி
very easily say genetic. அம்மாக்கு இருக்கு நம்மளுக்கு இருக்கு. Genetic. It's not a genetic. It's not.
So I think we have to do something about it lah. I know.
Yeah, seriously, I have to KKM have to look. Seriously, have to look this problem. And they're wasting so many billions of money. They're pumping in the KKM. All the drugs never cure. There's no any one drugs can cure chronic disease. Hypertension cannot cure. Diabetes cannot cure. Rheumatoid arthritis cannot
Adversely,
cure.
it's making worse, I think.
Making worse, much
Long
worse.
term.
Every year there's new medication will come. New medication never cure. Only they control the symptom only. You can see we take medication, pressure come down, but never cure. Stop, go up.
And cost of medication is getting
Cost
higher and
and the
higher.
side effect, kidney problem, the heart problem, lot of side effect, and you look like a zombie. You know, like a healthy lifestyle.
Yeah.
You must be healthy.
Doctor?
No, if they want to contact you, how can they contact you, Dr. Mani?
Can we give your number below or email or anything?
Problem.
Yeah, then தயவு செய்து அப்புறம் நீங்க வந்து
I don't promote myself.
boleh
Most now they know me.
kita akan apa pamerkan tayangkan nombor Dr. Mani dan juga other details. Kalau ada pertanyaan atau nak berjumpa for consultation, boleh jumpa dia. But definitely it's not free. But I hope it's reasonable. Untuk penonton sana sini khususnya. Jadi saya harap ini dapat membantu anda lah. Kita secara jujur we want to help our people because I'm seeing it's getting worse. Especially the B40, they got no awareness. They don't know how to come out from that cycle. And they don't know. They only the only place they can go is government hospitals. Make them wait for 3 months. If anything happen in between, they don't know what to do. The last thing they will do is just send them for mortuary.
Yeah.
But now the current governments are doing good job, Madani and Selcare, a lot of things. But people not awareness. The Madani also good health. Okay, doing current okay.
No, I mean the services, of course. But you look at because of the number of hospitals and number of patients, so that per doctor per patient ratio, it's all affecting that quality of healthcare, doctor.
Yeah.
So and if you ask me, if we ask Kerajaan Madani to solve this within 3 years, it's impossible. No way
Yes,
can solve.
cannot. Yeah.
So it will take time. By then, we might lose thousands of patients.
Yes, suppose in Malaysia, I mean the government must be less hospital, less patient. Because the problem is our KKM never focus the preventions. They focus the prevention from there, I think Tun Raza sampai them, merokok, tanam merokok. It's already gone, sorry. They only them berhenti merokok itu aja. Campaign jangan merokok. It's a gone story. It must be.
So those days they have budget for that prevention. I don't know whether they still have. Dulu My Sehat, they have this budget. They will do all kind of programs and also campaign to prevent people from taking sugar and Sekarang pemimpin takut nak bagi tahu nasihat kepada orang. Katakan Prime Minister today atau anybody health minister kata, you orang kata mahal-mahal jangan ambil gula. To of course satu kurangkan kos, satu untuk to prevent penyakit. Orang akan perli dia. Dia kata see lah, this is how the government is handling the issue. So dia nak cakap pun tak boleh cakap. Dia pun takut nak cakap. To be very sincere, it's nowadays because of this politics susah.
Yes. But he must know what to talk actually.
Exactly.
He must know our health first.
I think the government also have started with awareness. Campaign is there.
But
I think
enough.
recently,
Not reaching to the people,
Right.
Not
Yeah.
Especially that
Various
group.
groups. Yeah. No, even I think last week, senyum sudah manis, anda tak perlukan gula.
Yeah.
That has become a tagline now. Hopefully it works. I do not know to what extent. Kita harap kesedaran akan ada dalam kalangan semua kumpulan sasar.
Betul,
Kehidupan kita akan menjadi masyarakat yang lebih utamakan kesihatan dan menjadi masyarakat sihat.
Betul. Yeah, I think sugar lah mainly.
Sugar, zero sugar.
Zero sugar.
Yes, no need sugar.
Campaign.
No, nice word. Coffee
Zero
without
sifar.
sugar.
So no need sugar. Look at my coffee. Zero sugar, no milk also.
Good. Okay, doctor.
Thank you.
That's all from us.
Thank
You have
you very
anything
much.
to say, your viewers?
Okay, what I would say for all our follower Rakyat Malaysia, I hope you all follow FDM lah, Family Dr. Mani, that all the chronic disease, diabetes, hypertension, heart disease or rheumatoid arthritis, thyroid issue, so many chronic disease where we can reverse itu semua, bukan semua hidup penyakit. Can reverse and be healthy. We can be healthy, okay? So mitos-mitos yang mengatakan bahawa ini adalah semua hidup penyakit ini semua hidup sampai mati, itu adalah salah, okay? So mitos lah.
Okay.
Okay.
Kami daripada Doctor, do you have anything to say?
No, I think thank you so much to join us today, Dr.
Thank you
Mani.
very much calling me.
Yeah.
Thank you, Doctor. Thank you for coming.
Awareness for the rakyat.
Yeah, kita actually that's our intention.
Yes, very good.
Kami daripada sana sini ucapkan terima kasih kepada Dr. Mani yang sanggup datang meluangkan masa berkongsi pandangan dan juga pengetahuan beliau dengan secara ikhlas nak membantu rakyat Malaysia untuk mengurangkan pesakit-pesakit kronik di kalangan kita.
Yeah.
Jadi as I said earlier, we will publish his number and contact details, so you can consult him, you can talk to him or his clinic and get some good advice and have a better life. And as Dr. said, love yourself. Yeah. So dengan tu kami mengakhiri podcast Sana Sini yang ke-39. Harap berjumpa lagi di podcast-podcast yang akan datang. Sekian, terima kasih.